So it works essentially by three mechanisms. Unlike our meds in psychiatry, which are effective about a third of the time, ketamine infusion, in contrast, is effective 65 to 75% of the time, and sometimes immediately upon the first infusion. Generally works through, I guess, the first wave of benefit in treatment-resistant depression or anxiety or PTSD or suicidality or burnout syndrome would be the infusion itself. It's state-dependent, it's mildly psychedelic, so as such it's experienced as a pleasurable process. Most people, when they start doing the infusions, they like them so much because they're both effective and pleasurable, they continue to do them. There's an opportunity there in that state-dependent place that you go in ketamine infusion to do therapy. So being part of a psychiatric practice, as our ketamine infusion process is, as opposed to a clinic, often the clinics, as sort of a point of issue with a lot of the clinics. They're often not connected to a mental health provider or specialist, and a lot of times the psychiatrist or therapist doesn't even know that their patient is going to a ketamine clinic, almost like a psychedelic tourist is how some of these things come to be. But it's a shame because there's an opportunity there to do therapy where you're not as firmly holding your stance on things. You're a little bit more malleable as far as it comes to not being so attached to whether someone wronged you or where you were in the process of things, where you're allowed to actually get an idea of the situation from a more objective standpoint and less attached standpoint. Easier to let go of resistance and come to some conclusions or insights during the therapy process. The next wave of benefit comes with glutamate release, which is excitatory neuropeptide in your central nervous system. Generally it is activating, so it feels good and works for depression. And then at about 6 to 18 hours in, there's also metabolism of the ketamine, which the metabolite is also useful for depression, anxiety, and things of that nature. So it's basically 3 waves of benefit. It's used off-label by psychiatrists and I guess other providers for treatment-resistant depression because the largest body of research is for treatment-resistant depression when it comes to ketamine infusion for psychiatric illness. But it's actually helpful with anxiety disorders, OCD, PTSD, bipolar disorder, acute suicidality. It's one of the only medications in our regimen, or our armamentarium of medications that is effective for that, the other one being lithium, and it's good for burnout syndrome. So ketamine at a much higher dose is used and known as a dissociative anesthetic. As such, and being that it's a psychedelic medication, the effect that you get is you're less attached to your resistances. Could be that you felt like you were wronged in a situation or someone else is to blame for a situation. You're not quite as attached to your position. You can kind of see things like sort of removed and objectively, which is a great opportunity to do therapy. The experience itself is state dependent. It's what I mean by that is it depends on the set and the setting, and so within our practice, which isn't a clinic, it's a private practice that happens to offer ketamine infusion for our patients who are, comfortable and trusting of the doctor-patient relationship or the provider-patient relationship, in the comfort of their own private practice that they know and feel at ease in. There's a chance to do work that within the ketamine suite that we have sort of envelops the patient in this sort of dark, warmly lit space where we pay attention to such things, as I said, as the lighting. We have aromatherapy going, we have theta brainwave music going, so the entire experience, generally in the presence of either me or one of my staff the entire time and monitored the entire time, is a very comforting and safe experience for most patients. In that space, they generally feel at ease to start to examine some of the things that are bothering them without the hindrance of as much resistance that comes up, and as such you're able to find keen insights that you're not ordinarily able to find. It's very safe if properly done. It's very, very, very well tolerated. Done well over 1,000 infusions. We haven't really had anyone who's had any issue whatsoever. The most frequent thing that we see, and this is very occasionally, is mild nausea during the infusion, which we don't even see that anymore because we pre-treat with a little anti-nausea medication. Since we have venous access, we just give a little bit of ondansetron, which takes away nausea, so the person never even experiences it. But we haven't seen any untoward side effects by the time we're done with the infusion, which is basically a 40-minute IV, which is very, very well tolerated and comfortable. We have very comfortable chairs, and it's in a warm and comforting environment. The whole thing is monitored the entire time. It's very, very well tolerated, and like I said, most people who begin doing infusions continue to do them. Usually the durability of the infusion is roughly 6 to 8 weeks. There's some outliers where people have a longer durability of the infusion or duration of the infusion, after which, when they start to dip, say at about 8 weeks out, we would do a single booster infusion or maybe 2 additional booster infusions just to get the blood concentration up area above the curve where they're feeling good again. It does. It helps 65 to 75% of the time. The reduction in symptoms is significant, very significant. Up to 50% reduction in Hamilton A and Hamilton D anxiety and depression scores. The effects can be immediate, so I've had people come in massively depressed and suicidal. In the morning, we send them through our pre-workup process where we get lab work and get a baseline EKG, do some questionnaires so that we can objectively chart their progress, have them come back in the evening, do a ketamine infusion, and have the client look up at me and tell me, I just wouldn't have believed it. I'm no longer depressed, I'm no longer suicidal. If you had told me that I would feel like I do now, given how I felt this morning, it's miraculous. So we've had some amazing results. So one of my clients who's very nuanced at doing therapy that's supported or assisted with ketamine infusion has told me that he feels as if the infusion allows the therapy to be about 5 times as effective. You can get there quicker because you're not as encumbered by your resistance that we normally generally have, and you're able to let it go or be less attached to your position on things so that you can explore what's actually going on and get to the root of things. Also, being that it's a psychedelic medication, it allows you access to parts of your mind that you're not ordinarily able to access as easily. The medication itself allows you to basically attain great insight and clarity because you're able to shift between different cognitive states. Yes.
Good answer.
So ketamine infusion and some of the psychedelic meds actually mimic some of the aspects of flow states, which are high performance cognitive and action states. It gives you a glimpse into some parts of your mind, the unconscious or subconscious parts of your mind that have wildly ranging neural connections and unlimited RAM, as opposed to our extrinsic system, the system that we're using now to have this conversation and have rational thought, critical thought, which is a very limited and localized system within the brain. So the ketamine infusion actually allows a great opportunity to do therapy if you have the resource to do it. One of the critiques of ketamine clinics, which often aren't, and this is not a critique per se by me, but a critique of these clinics, is a lot of times they're not run by psychiatrists or mental health professionals, or not connected to mental health treatment, and so you miss the opportunity to do very insightful and powerful therapy that's assisted by the ketamine infusion, as opposed to a clinic where you just get an infusion and hopefully there's therapy somewhere in your future. It's pretty trippy from the the reports of the client, one or two clients we've done that with. So we started to experiment with that a little bit. When you have something that inspires awe, like looking at the night sky or the ocean or the Grand Canyon, something that the mind can't really wrap itself around, it releases neurochemicals, your own neurochemicals in your brain, and it can basically boost your mood and mimic some of the characteristics of a flow state or a high performance cognitive and action state. Made sense to us to experiment with nature and scenes that in virtual reality give the client a sense of the vastness of nature, and for that reason, or with that in mind, what we're trying to do is inspire